Here are the top three news stories that have dropped over the last 2 weeks that you probably haven't read. Why? Because ain't nobody got time for that, but I do. And I'm going to break them down for you here in the next few minutes. What you need to know, how it's going to impact your business and your employees, and more importantly, what to do about it. So here we go. I'm going to start off with these articles were all published in the Wall Street Journal. I love the Wall Street Journal, and I think hands down they have done the best job of covering what's going on in healthcare and health insurance really over the last 13 years, 14 years. In fact, if you were to go back to 2015, reading the archives through today, it's almost an unbelievable, inconceivable story that's pieced together. But often what happens as these articles drop, subscribers are getting one piece of the story. But to really understand what's going on in healthcare and insurance, you got to put all the pieces together, which is what I'm doing with this Benefits Insider podcast. But today I want to focus on these three stories. The first one was published last week, and the title of it is Healthcare Premiums Are Soaring Even as Inflation Eases. And there's some great graphics in here, which I'll share on the screen as we talk through this. But the big takeaway in this article is that a recent study done by Kaiser Family Foundation, who does a phenomenal job of tracking what's going on in the industry and publishing that data for the public good, is showing that for the second straight year, health insurance premiums for employer-sponsored plans are rising 7%. So this is 2 years in a row that it's gone by 7% or more. And what this has done has increased the family premium by over $3,000 annually. And the average family cost of insurance is $25,500 nationally. Now, the interesting piece of this, that survey found that employers are picking up a higher percentage of that family premium, bringing down that cost. And the question you ask is, why? Well, I think a big contributor to this is the tightening labor market. All of us are out in the marketplace. There's a shortage of talent. Employers are realizing that they're going to have to offer better benefits. It may cost them more, but it's a cost of doing business to attract and retain talented people. In years past, when I would meet with employers, oftentimes I would hear the sentiment that benefits don't really come up, or the cost of benefits don't come up in the recruiting process. It's more of, did we offer health insurance or not? But what this article really lays out is that benefits are becoming a hotter topic in discussion as firms are trying to recruit talent. Not just do you offer benefits, what does it cover and what does it cost? And what I think is really interesting about this particular article, there's a graphic here that shows just since 2005, what family premiums versus worker earnings versus the overall inflation rate. And when you look at this chart, particularly over the last couple of years, you see that percentage increase in workers' earnings is going down as family premiums and inflation are going up. Now, you see it in the most recent years, it's trending down, but the family premiums are skyrocketing relative to inflation and workers' earnings. So what does that tell us? It tells us that in relation to what workers earn, they're paying more for their coverage. And it's kind of an unfortunate thing when you think about what's happening in our economy today. Your average worker is struggling to pay rent, get a house, buy cars, put food on the table and gas in their tank. And this, to me, when I think about this, just based on the work that we're doing with our clients, it's a real area of opportunity. It's a high leverage, high return type endeavor. With it being probably the second or third largest item in your P&L, it's a big opportunity if it's addressed properly to generate a return for your business and your employees. When you look at what's going on inside of those plans, not only are premiums increasing, according to this survey, the average deductible for workers are rising as well. And I'll show this chart here that goes back through 2006 to today. You can look back. It's a steady up and to the right increase for deductibles. And you ask the question, why? Why are deductibles rising? And so the most common way that employers like you and many others that we speak with are trying to address the rising cost of health insurance in the businesses, sometimes you have to water the benefits down. So you might get a 10 or a 20% increase in your annual premium. And one of the ways that you'll look to offset that cost is raising the deductible, increasing copays, narrowing your network, or any other of a handful of items that carriers provide to you to essentially buy less insurance. So that 12% increase that you received this year, if you make some minor plan adjustments, we only raise the deductible $500. We'll give you some rate relief for that. But when you do that year after year after year, you look back over 5 years, and what used to be a $1,500 deductible is now a $3,500 deductible or $5,000 deductible, and you're really not getting what you're paying for at the end of the day. But really, my thought on that is we're not addressing the real cost driver here, which is the cost of healthcare, the cost of claims that those carriers are paying out for our employees' healthcare. When you think about health insurance, most of these entities, they're for profit. If you look at the way those carriers make money, they don't have the same incentive that employers do. They're not trying to lower the cost of healthcare necessarily. And I've documented this in prior episodes. Check those out. I not only detail how the carriers make money, but also most importantly, what to do to prevent it. One other interesting piece that came from this article was that lower wage workers are probably going to pay less. And some may think this is good or bad, but this is actually part of the Affordable Care Act. There's limits on what employers can charge their employees to meet their affordability testing. So you're seeing workers on that lower income scale that employers, to be compliant with the law, can only have, there's a threshold of what you can charge your employees to remain compliant with the law. The second piece that came out of this is that there's 1 in 5 employers in America today, particularly along the large segment, that offer a skinny version of health insurance, still compliant with some components of the Affordable Care Act, but it doesn't provide true medical coverage. So you're seeing employers do one of two things, or both. They're limiting what they charge lower income employees, but in addition, or in replacement of that, they're offering what's called MEC plans, minimum essential coverage plans, that may cover preventative care. Maybe there's some basic generic drug coverage, but there's no major medical coverage for inpatient hospitalization, ongoing continuing care, or if they've got bigger healthcare needs than what a small plan like that would provide. Is that a good strategy or not? It really depends on how those plans are designed. And for most employees, just think about your average employee. If they're making $50,000 a year, they're not going to be able to afford family coverage, even if the employer is subsidizing it and is only charging the employee $1,500 a month. Just put that into perspective as a percentage of their income. Most of them are going without insurance at that point. And so an employer that's willing to offer some type of coverage in many cases is better than going completely uninsured. So the next article is really interesting to me, which is, why do health insurers keep getting slammed with higher costs? And what's particularly interesting about this article, it talks about the earnings of United Healthcare. They just recently released their third quarter earnings report, and it didn't meet analyst expectations. They only made $6 billion, but it wasn't quite what the market was expecting. And they cited specifically the performance of their government plans, particularly their Medicare Advantage and Medicaid plans that they offer. They're citing increased costs and not high enough reimbursements from the government. So the government market works very differently than the commercial payer market, which you as an employer are in today. They don't get to set the pricing of the insurance plans. The government does that. So what do? They're using the commercial paying side of their business to help offset their reduced earnings on the government side. Essentially, we're subsidizing what's happening. Why can they do that? Well, let's think about it. They get to issue the renewals. There's not a ton of competition in the market. If you're with a major carrier, name one of the big four, there's not a ton of competition between those carriers. They have the ability in many regards to set the price of coverage. And so they're using the commercial market to offset losses or reduced earnings that they're getting from the government market. One of the biggest drivers of cost for these insurance companies today is what they're paying facilities. That's the local hospital in your city, and the cost for specialty medications. And you think about what happened during COVID. A lot of nurses and physicians got burned out. and there's a critical shortage that we've got for those positions in the United States, and hospitals are having to pay more doctors and nurses to keep them employed in their facilities. You talk about a tight labor market and competition. Hospitals are feeling the brunt of that right now, and they're having to pass those increased costs on through their pricing demands back to insurers for reimbursements. Hospitals are very similar to the insurers on the government side. They don't get to set the pricing for their services. And so as costs continue to rise, they demand more money from the commercial insurance carriers. So you're seeing that right now. A lot of the insurance companies are telling us, based on hospital demands for reimbursement rates going up, they're having to increase pricing for the commercial markets to help offset that. And when you think about what's going on with hospitals in particular, when we talk about pricing demand, and if you look around your city, there's probably one or two dominant hospital facilities. And what they've done over the last 15, 20 years is they've gone out and bought the smaller hospitals. They've purchased physician groups, surgical centers, imaging, and they've integrated into primary care, specialty care. They do everything. They've become so large that an insurance company like United Health or Blue Cross or Cigna or Aetna, it's almost like a too big to fail scenario. Any one of those four networks can't afford to not have the biggest hospital system in their network. So if you think about this from an insurance company and a hospital standpoint, the hospital looks at the insurance company and says, you can't afford to not have me in your network. If I drop out of your network, all the employers here in this city are going to move to somebody else. So pay the piper. I'm not saying that that's good or that's bad. Hospitals need to make money. They provide critical care to all of our people. But I'm just pointing out some of the dynamics that are happening in that industry, that the insurers have the ability to pass that cost on to us, resulting in higher premiums. Which leads me into the last story for today. Health costs and flat raises are set to squeeze employee paychecks again. According to a benefit survey conducted by Mercer nationally, employers are giving merit raises of approximately 3.3% for 2025, while health insurance costs are rising 7%. Employers are picking up a piece of that. The average increase to employees is going to be 5.8% on average. So to put this into an example, take your average employee, maybe they make $50,000 a year. That means at a 3.3% raise, their annual income is going to go up $1,650. But with their increase in insurance premiums, which is $1,680 on a net basis, they're actually getting a pay decrease. And what I find interesting about that, particularly in a competitive marketplace that we're in today for labor and talent, a lot of companies are calling up employees. They're headhunting on LinkedIn. They're cold calling, emailing, and they're offering raises to employees. And so when you think about your employee who's sitting at their desk like I am today, I get a call from a headhunter. I see my health insurance benefits at the same time I see my merit increase, and somebody's going to offer me $5,000 more to make a switch. Kind of a compelling offer, which is why I go back to earlier in our conversation. Employees are starting to ask questions specifically around benefits packages with their current employer, with a prospective new employer, because they're now seeing how it erodes their actual income at the end of the day. So what's an employer like you supposed to do about this? I detail in previous episodes specifically what's driving your costs higher every single year. It's misaligned incentives of the carriers. They don't have the same profit motive that you do. Their motive and the way they make money is, as your costs continue to rise, so does their profit, and they make money off of your rising claims and many of your rising claims. So that's the first step. There's some other strategies that can be employed to help lower the cost of healthcare and without limiting the access to care that your employees have. And in many cases, you're able to increase the access to care that your employees have today. Many of your employees, they may be sick or they may be hurt, and they're not getting the care that they need today. Why? Because they can't afford it. They've got a few $1,000s sitting aside in savings. There are recent studies that show that many Americans have less than $1,000 in their bank account, which is sad to me. But let's just say you have an employee that's got a $10,000 rainy day fund. Think about your average employee again. I'm not asking about you. Think about your average employee. Maybe they've got a few $1,000s set aside. If they get a minor ache or pain and it becomes something a little bit more major, or they think they may be sick, they may have cancer, they may have something. I heard somebody tell me the other day, and I was in a meeting, and they said they were having chest pain, and they didn't go to a doctor to get it checked out. And I was like, why would you not get that checked out? I'm scared at what it's going to cost. I don't have enough money to pay for that. And I thought to myself, this isn't even an average employee. Like, this is somebody that makes pretty decent money. And so I started asking more questions about it, and they're worried that I might have to have a $5,000 or $6,000 out of pocket cost. I can't imagine paying that. And that's the mindset of so many people inside of our organizations. But guess what? One day that issue that could have been treated very early on at a low cost is going to become something catastrophic, and it's going to cost your company more money, either if you're self-funded at that time, or it's going to be factored into your renewal. So when you think about it from their perspective, that money that they've got set aside, they don't want to use it for healthcare unless they absolutely have to, because that money is their kids' college education. It's the down payment for their new house. It's their vacation fund. It's everything that their life and dreams are built upon, or that they're aspiring to, that could possibly just get wasted in an inefficient healthcare system. There are ways to design this better. Look back through the early episodes of this podcast. I detail it in great detail for you to be able to take this and use it inside of your business. I'll put a link to the playbook. I've got a Benefits Insider playbook that explains in more detail where the misaligned incentives are, how to design better care. You can download it. It's free. And if you got any questions, feel free to reach out. I'm here to help in any way I can. Until next time, take care.